Mr. President, I rise today with some starting news from the state of Montana, and I don't think it's singular to the state of Montana. It's news that drives home the need to get a handle on America's health care problem. Being a senator is a tough job, but it isn't the toughest job I ever had. The toughest job I had was serving on the school board back in Big Sandy, Montana. I also am a former teacher, so as a former school board member and a former teacher, I appreciate the long, hard, often thankless hours that teachers put in, and to say that they're not the highest paid profession would be an understatement. So, Mr. President, I was shocked when I heard about the bad news hitting teachers all across Montana. This week, my staff and I spoke to folks like the ones in Elysian School District in Billings, Montana. Employees there just received word that their health insurance rates are going up, and I mean way up. Normally, a big rate hike might be something like 10 or 20%. Sometimes we hear folks getting slammed for 30 or 40%. But the folks at Elysian, their rates are skyrocketing this year by 69%. And you think that's bad? Talk to the folks in Hinsdale or Saco, Montana. They just found out that their rates are going up too, by more than 70%. And then in the Nashua School District, rates are going up by 72%. And the rate given to those employees who purchase family insurance, well, they're going up by 83%. Let me repeat that, Mr. President. Health insurance rates that are going up by 83% in 1 year. For those in Congress who think nothing is the best option when it comes to health care, I have one question. How much more of their paychecks are Montanans supposed to fork over before Congress finally reforms our broken health care system? The folks I'm talking about don't belong to any big nationwide corporate insurance system. They're not paying for anyone's big million-dollar salaries or lobbyists or advertisements. It's just the cost of health care going through the roof that is breaking these Montana families. For those in Congress who say that the American people don't want or need reform, let them talk to the folks that I've talked to, like the teachers seeing these rate increases, like the Montanans being forced to sell their family farms and ranches because of medical bills, like the Montana small business owners who can't afford to insure their employees. On Christmas Eve, Mr. President, I stood in this chamber and cast a vote to keep government out of health care, to cut the national deficit, to hold insurance companies accountable, to strengthen Medicare, and to slow the rise of health care costs. I'm very proud of that vote. Now this week, after months of listening, debating, and voting, Congress has a chance to work together to get something done. If Congress does nothing, we know what will happen. Medicare will go bust. The costs will continue to break Montana's families and this country, and no one will hold insurance companies accountable. And year after year, hardworking Montanans will continue seeing more of their hard-earned paychecks eaten up by health care costs. I'm not in the do-nothing camp, especially when hardworking Montana families are trying to make ends meet with 83% rate hikes. With that, Mr. President, I yield the floor.